Coronavirus case rates for children are declining in LA County. However, according to the American Academy of Pediatrics, kids make up more than a quarter of this week's cases across the country. And that is a trend that comes as more students, of course, are returning to school now. Joining us live, Dr. Rishma, pediatrician with Dignity Health Northridge Hospital. We want to thank you for being with us tonight and also ask you personally, what are you seeing right now among kids?
We're seeing a rise in cases, exactly what you said. Their case count is up all across the country. Currently, 1 in 4 of all coronavirus cases are in children. Children made up 250,000 of all coronavirus cases this last week. And of course, with increased cases leads to increased hospitalizations, and that's what we're seeing across the country.
And in LA County, kids' COVID cases, of course, as you said, going down. But what is the risk since there is exposure to people now who are unvaccinated?
The risk is, well, we know this virus goes after those that are unvaccinated, and that includes children. And so when children are surrounded by adults and other kids who aren't vaccinated, they're at increased risk of obtaining this virus and getting sick. And so illnesses can be ranging from something mild to something even more serious. And so we have been seeing serious illness in this last surge during this Delta virus.
So wondering, what do you tell families are the best ways for parents with children too young to be vaccinated to cope?
That is a good question. So vaccination, that's the first thing I tell parents. If your child is over 12 years old, there is no reason that they should not be vaccinated at this point. Other things are just masks. I can't stress this enough. If your child is above 2 years of age and older, they should be able to wear a mask unless they have a medical exemption. Other things that I stress upon is the social distancing. If they can, when they're in school, make sure they're practicing social distancing. If they have to, have a play date with their friends, try to do it outside. Make sure when you are in school, you have proper mitigation factors and guidelines that are in place, such as, like I mentioned, I can't stress this enough, masks, social distancing, good hand hygiene, and making sure like high-risk activities such as eating and singing and other things are performed outside.
And I guess it's somewhat the same as when now we have the flu season starting up. Are there any additional ideas that you have for parents to keep everyone safe? I mean, besides like hand washing and, as you said, masking?
Yes. Well, definitely recommend to get the flu vaccine this year. You can go to your pediatrician's office and make sure that, if you're 6 months and old and above, you can get the flu vaccine. So it's really stressed upon to make sure you get the flu vaccine this year. We definitely don't want to bombard our children's hospitals and our children's floors and ICUs with flu cases also this year.
All right. Thank you so much for all of your information. Dr. Rishma, thanks for joining us tonight.
My pleasure. Thank you.
All right.